Welcome to the Spanish for Medical Professionals. Hi, this is Dr. Villavicencio. Today I am having here for you a very short meeting. It's a vocabulary course class where we are going to remember something that we already learned in the first and second class. Is how we are going to introduce yourself. So the vocabulary that we are going to be studying today, it is how to say doctor, how to say nurse, how to say I am a medical assistant, I am a diabetes educator. We already saw that in the Spanish for Medical Professionals class 1 and 2, modules 1 and 2, but today I summarize it for you review, and this is going to be fun and fast. So go with me. So the patient, tell the patient, who are you? So sometimes the patient is in the room if you're working in a hospital and you want to introduce yourself to the patient and saying, I am Dr. So-and-so, or I am the nurse, or I am the diabetes educator. So you are going to start that sentence with yo soy. Yo soy means I am, and we use yo soy to describe or job or career or profession. So bear with me, let's start with some examples here. So yo soy describe the occupation and the profession. So let's look right here, up and left. Let me grab my laser pointer here and let's start. Look, this lady saying, yo soy enfermera. If that's a male nurse, have to say yo soy enfermero. Remember that the nouns in Spanish have to match the gender and number. That's something that some languages do have it. Like French language has it, and the Spanish has it. The English, you don't. You said, I'm a nurse, and nurse is nurse for male and female. In Spanish, you have to match and said enfermera if you consider female, or enfermero if you consider male. So enfermera, enfermero. So the last letter, the A and the O, is the only difference. Okay, so let's look this one here. See my pointer? Yo soy doctor. Yo soy doctora. That is, I am a doctor, male and female. There is some expression that you can say for both, and you can say yo soy médico. When you said yo soy médico, you don't have to specify if you are male or female. You can say yo soy médico, yo soy el médico. Medical assistants. Medical assistants, we can say it in Spanish in two different ways. Yo soy auxiliar de enfermería. Auxiliar is like a nurse, auxiliary people, so that doesn't have a specific translation, but you can say yo soy auxiliar de enfermería, or you can say yo soy asistente médico. I think it's going to be easier for you say yo soy asistente médico, because that is most familiar, sounds like more in English than medical assistant, asistente médico. So let's do a sentence here. Yo soy auxiliar de enfermería en Evanston. O yo soy asistente médico de Evanston. You can use en or de to make these sentences. And if you are going to ask me why in some sentence I can use en and in others I can use de, then you should see one of my grammar videos about the use of en and de. It's already in the Facebook and the YouTube page. So, enfermera, enfermero, doctor, doctora, asistente médico. Let's do the next one here. So who do we have in the upper left? We have a people that work in the front desk. You call reception, recepcionista, we call PSA. So look what she's saying. Yo soy recepcionista. Reception, recepcionista. Listen my pronunciation here in this paragraph. Buenos días. Yo soy Jessica. Yo soy recepcionista, or yo soy la recepcionista. I want you to pay attention with something here. So let me grab my pen and let me write here something. In Spanish, you can say yo soy Jessica, and you are saying I am Jessica, but also you can say me llamo Jessica, my name is Jessica. So when you are introducing yourself to a patient that's coming, you said, good morning, buenos días, yo soy Jessica, or I am Jessica, or me llamo Jessica, my name is Jessica. Either way is fine, is okay. And look here, so after that, she's telling what is the job description, what she's doing there. Yo soy recepcionista, or yo soy la recepcionista. So in the last sentences, I am using the article. El, if you are el recepcionista, it's a male, or la, if you are la recepcionista, you are female. Pay attention here that recepcionista doesn't change in recepcionisto. Some words in Spanish, and there is no very clear rule how you are going to memorize. Some words doesn't change the gender, even though that pretty much everything, there is always going to be exceptions, and this is one of the ones. So I tried to put in this exercise, in this presentation today, a lot of them so you can memorize. If you made a mistake and you said, yo soy recepcionista or recepcionisto, it's going to sound a little bit funny, but everybody will understand. That's okay. So what's happening here in the lower right-hand side? Look at her. It's the sunset here. She's female, and here is saying that she's the office manager. How we said office manager? Gerente de oficina. Gerente de oficina. Office manager. So probably you already realized that office, you said in Spanish oficina, and gerente, you said manager. This is another example that we don't say gerento de oficina. It's gerente for male and female. And if you are pronouncing this like gerente, then you have to watch my video about how you are going to pronounce the G and the J in Spanish. It's in the Facebook page. So it's gerente, it's not gerente. Gerente de oficina. Let's read this paragraph here. Buenas tardes. Me llamo Mónica Fine. Yo soy gerente de oficina. Yo soy la gerente de oficina de Gurney, de New York, de Chicago, o yo soy el gerente de oficina de Gurney. So probably you have already realized in these examples when the noun does not change, like recepcionista, recepcionisto, gerente, gerenta, gerento, that doesn't change. It's just recepcionista, is just gerente. We don't change here. But how we realize if the person is male or female? Of course, because you have an article. It's la recepcionista. If you receive a mail saying, hola, yo soy la recepcionista, then you know that the person that is writing to you identify herself as female. If something said, yo soy el gerente de la oficina, I am writing to you because blah, 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 then you can realize that el gerente, the person that's writing to you, it's a male. That is easier because sometimes in English, somebody's writing for you an email and you are, geez, this name is so weird. I don't know if this is a male and female. I don't know how to answer. Is Madame, is Miss, is Mrs., is Mademoiselle? You don't know what it is, right? But in Spanish, it's easier if they said, yo soy el gerente, oh, he identifies himself as a male, then you know how to answer that letter, that email. If somebody said, yo soy la gerente, she is identifying as a female. And in this one up here, I'm saying buenos dias because the sun just is starting to come into the sky. Is morning, buenos dias. In this is a sunset, the sun is hiding here from the sky. Is the evening, it's buenas tardes. Buenas tardes you use, like for example, afternoon, after 12 midday, noon to like 6, 7, around the time that there is no more sun outside, you say buenas tardes. When it's dark, you have to say buenas noches. Okay, so let's do this next one here. So who is there? In the upper left, that is Kendra, that is a lab technician. So let's learn how to say lab technician. Yo soy técnico de laboratorio. Yo soy técnica de laboratorio. So you don't say laboratoria because we are not talking about the lab. We are talking about the technician. So that's why laboratorio is always laboratorio. But change técnico or técnica because that makes reference to this person here. So técnico for male, técnica for female. So she's saying, yo soy laboratorista. So there is two different ways to say técnico de laboratorio or laboratorista. Both is lab technician. Okay, so here we have a little paragraph. Buenos días, yo soy Kendra, yo soy técnica de laboratorio, right? And here, who do we have? Do we have somebody that is radiology technician, rad technician? Yo soy técnico de radiología, yo soy técnica de radiología. So pay attention in this. You use técnico and técnica for the lab, and técnico and técnica for the rad. So probably you realize already that técnico, técnica means technician, it's a rad tech. And let's read the paragraph here. Buenos días. Me llamo Jennifer Ashton. Yo soy técnica de radiología de Skokie. So let's learn a couple of vocabulary here. Cirugía. Cirugía is the department, is the surgery. Who is the people who work there? The surgeon. Yo soy cirujano. Yo soy cirujana. It's a female. It's not cirujano. It's not cirujana. It's cirujano. It's more like your age. Cirujano, cirujana. For male and female. Let's see this. Neurocirugía is the department. Who is he? The neurosurgeon. Yo soy neurocirujano. I'm not saying neuro, I'm saying neurocirujano. Yo soy neurocirujana. Neurocirujano, neurocirujana. Also change male and female. Who is this guy? The department is the traumatology. You call them ortho guys, right? Yo soy traumatólogo. Yo soy traumatóloga. Traumatólogo, traumatóloga. This here is the plastic surgeon. The department is called cirugía plástica. And what the doctor is saying, yo soy cirujano plástico o yo soy cirujana plástica. There is a typo here. It's not plática, it's plástica. Sorry for that. So let's see the next one here. GI department, gastroenterología. Gastroenterología. He's saying yo soy gastroenteróloga. So for the female, you just change the O for the A. And yo soy gastroenteróloga as a female. Next department, see the thyroid. We blame the thyroid for everything, right? Endocrinología is in the endocrinology department. Who works in there? The endocrinologist. Yo soy endocrinóloga. If it is a female, we said yo soy endocrinóloga. Endocrinólogo, endocrinóloga. Heart doctor, cardiología. That's the department, cardiology. Who works in there? The cardiologist. Yo soy cardiólogo. Yo soy cardióloga. Who works with the lungs? The department is neumología. Neumología. Yo soy neumólogo. Yo soy neumóloga. We don't say pulmonólogo, pulmonóloga. We said neumólogo, neumóloga. If you said pulmonólogo, we understand that, but that is not 100% correct. So, who is this guy? Intensive care. Cuidados intensivos. So probably you realize already that cuidados means care and intensivos means intensive care. Remember in Spanish, we kind of flip the order of the words sometimes. Let's see what he's saying. Yo soy intensivista. And that doesn't change. If I am female, I said yo soy intensivista. If I am a male, I said yo soy intensivista. The only way that we are going to differentiate at some point is when in our sentences we are going to say yo soy el intensivista. Then you know that it's a male because we are using el, or you can say yo soy la intensivista. In that case, we are using la, and we identify then a female. Same is going to happen with this one here in the lower left, anesthesiología. Anestesiología is the department, right? And we can say, yo soy anestesiólogo, yo soy anestesióloga. Same here is going to happen with psiquiatría, psicología. That is the department of psychiatry and psychology. Yo soy psiquiatra. And same thing is going to happen here. Let me grab my pen here. You said, yo soy el psiquiatra. Or you can say, yo soy la psiquiatra. You see, psychiatrist doesn't change. But in Spanish, we have articles that has to change in gender and number. So if the psychiatrist is a guy, has to say, yo soy el psiquiatra. Buenos días, yo soy el psiquiatra. How may I help you? Or if that's a female, is going to say, buenos días, yo soy la psiquiatra. ¿Cómo te ayudo? Let me clear my writings here. If there's a psychologist, then we have male and female version for that. Yo soy psicóloga, yo soy psicóloga, psicólogo. Look at this one here. Dermatology department, dermatología. Yo soy dermatólogo, yo soy dermatóloga. When somebody's asking you, what is your profession, what you do for living, you can say, yo soy dermatóloga. Or you can say, yo soy psicólogo. Or you can say, yo soy anestesiólogo. Yo soy enfermero. Yo soy asistente médico. But if you want to introduce, try to use the article. If you are getting in a room with a patient and the patient is looking at you like, who is this person? You are going to say, buenos días, yo soy el dermatólogo. Ah, you're the doctor that's coming to see my rash. Yo soy el dermatólogo. Pero si alguien te pregunta, if somebody asks you what you do for living, you said, yo soy dermatólogo. So you don't have to use el, you don't have to use la. Okay, if I ask you what you do for living, you said, yo soy enfermera. Then I know right now that you are nurse and that's what you do for living. But if I am in the room and you come in with a needle to stick in my arm and you tell me, yo soy la enfermera, buenos días, yo soy la enfermera, then I can breathe because I know that you are the nurse that's coming to get my injection. Okay, so let me go to the next one here. OBGYN, what is the name of the department? Ginecología y obstetricia. Who works in there? Yo soy ginecóloga. If I ask this lady here, what do you do for living? She's going to say, yo soy médico. Yo soy doctora, yo soy ginecóloga. But if this lady come into the room to see this lady, is going to say, buenos días, yo soy la ginecóloga. Has to put the article in there. Who is this guy? This guy is a pediatrician, right? But he's very, very specialized in newborn babies. Neonatología. Neonatología. And he's going to say, yo soy neonatólogo. If it's a lady, neonatóloga. Who's this lady here? Pediatra. The department is pediatría. How she's saying, how she's going to answer when I say, what do you do for living? She's going to say, yo soy doctora, yo soy pediatra. If that is a guy, is going to say also, yo soy pediatra. Doesn't change for male and female. But if she's coming to the room and there is a parent with a baby, mom, dad, and a baby, she's going to say, buenos días, yo soy la pediatra, yo soy la doctora Samper, or whatever name it is. Yo soy la pediatra, buenos días, yo soy la doctora Samper. That's the way she will introduce. But if I ask, what you do for living, Mary? Yo soy pediatra. Okay, hope it's clear this when I use the article and when I don't use the article. Here, lower right-hand side, medicina familiar. Probably you realize that it's family medicine and you can see the word sometimes in Spanish flip, okay? Family medicine. we, the people that speak Spanish, we think in English, people flip the words. For people who speak English, they said, no, you are the ones that flip the words. Anyway, medicina familiar. What she's saying, yo soy médico familiar. Hey, Laura, what you do for living? Yo soy médico familiar. But if she's coming to a room of any of the patient, she's going to say, buenos días, yo soy la médico familiar. What's this? The department is oftalmología, and she's saying, yo soy oftalmólogo, or yo soy oftalmóloga. And what is happening here? The department is urología, urology, and the doctor is going to say, yo soy urólogo, yo soy uróloga. What's happened here? Ear, nose, and throat doctor is the easiest way because nobody wants to pronounce this. Otorrinolaryngología. What's the department? Otorrinolaryngología. So you have a homework right now. So you are going to write and pronounce this 100 times today. Otorrinolaryngología. And how the doctor is going to say, what do you do for a living, Susan? Yo soy otorrinolaringóloga. If that's a guy, he said, yo soy otorrinolaringólogo. Okay, next department here, proctology, proctología. And he's saying, yo soy proctólogo. Or if there's a lady, yo soy proctóloga. Look at the sentence here. Yo soy proctólogo en el hospital de Glenview. So I already using in the sentence here en, that means where I work. Means in or at. Yo soy proctólogo en means in or at el hospital de Glenview. Next one here. Who is this lady here? Hey, Jimena, what you do for living? I am a doctor. Probably saying, yo soy doctora. He probably said, yo soy internista. But if she has to introduce herself to the patient, she's going to say, hola, yo soy la doctora Jimena Rodríguez. Yo soy la internista. Okay, what's the department? Internal medicine, medicina interna. What you do for living, you don't have to use the article. You are introducing to somebody, you have to put the article in there. Okay, alergología, the department of allergy, allergologist here. Yo soy alergólogo, yo soy alergóloga. Who is this doctor doing here? He's putting some needles in somebody's back. Acupuntura, the department of acupuncture, acupuntura. Let's see how he's introducing him. Hola, yo soy el doctor Fernando Arregui, or Aguirre. What you do for living, Fernando? Yo soy acupunturista. Okay, let's talk about our nurses here. We talk about already the doctors. Let's talk about the nurses. When you want to introduce yourself or somebody is asking what you do for living, you can use these sentences here. You are going to start saying, oh, what you do for living, Susan? Yo soy enfermera de cardiología. Yo soy enfermera de pediatría. Yo soy enfermera de ginecología. So you start with the sentence, yo soy enfermera, I am a nurse. And if you want to give a little bit more details, you are going to say the department that you work. Yo soy enfermera de. De, in this case, means in. Yo soy enfermera de ginecología. Yo soy enfermera de medicina familiar. Yo soy enfermera de cirugía. Yo soy enfermera de urología. But remember, if you are coming to a room of the patient and that patient doesn't know who you are and you want to introduce yourself, this is what you are going to say. Let me grab my pen and you are going to say something like, buenos días, yo soy Susan, yo soy la enfermera de cirugía. Let's see if you are working in surgery. Buenos días, yo soy Susan, yo soy la enfermera de cirugía. I am the surgery nurse. If somebody said, hey Susan, nice to meet you, what you do for living? Hey, nice to meet you, yo soy enfermera. Really, what else you do? Yo soy enfermera de urología, if you want to give more details. Okay, so let's remove my pen here. Medical assistance, the same for medical assistance. You are going to start your sentence saying, yo soy asistente médico. Hey, Mary, nice to meet you. What do you do for living? Yo soy asistente médico. I am medical assistant. Or you want to give more details. My work is so amazing. Yo soy asistente médico de cirugía. Asistente médico de cirugía. If you go inside of the room and you are going to introduce to a patient, or one of my medical assistant is vitally the patients, they use this sentence. Buenos días, yo soy asistente, let me grab this here, asistente médico de la doctora V, or de, yo soy la asistente médico de medicina familiar. Let me do this slowly. You said buenos días, that means morning. Yo soy, I am, asistente médico, medical assistant of this doctor. De la doctora so and so, de el doctor so and so, whatever is the case. That's the way you introduce. Good morning, I am medical assistant of Dr. Summers, right? Or you use the sentence saying, yo soy la asistente médico de, I am the medical assistant de, in this case means of, family medicine. You are just saying the department that you work. If you don't want to say the doctor you work with, maybe you are working with so many, then you say the department. So this is the sentence. Memorize this, try to practice. Yo soy asistente médico de cardiología, yo soy asistente médico de pediatría, yo soy asistente médico de ginecología, yo soy asistente médico de cirugía, yo soy asistente médico de medicina interna. Next one here. But we have other people that work in the medical setting, in the healthcare setting. Who is here? These people is working with a lot of medical charts, is in the phone, talking and fighting with the insurance, and maybe sending the right codes. Yo soy codificadora. Yo soy codificador. Buenos días, yo soy la codificadora. Buenos días, yo soy el codificador. Hey Mary, what do you do for living? Yo soy codificadora en el hospital. Hey Matthew, what do you do for living? Yo soy codificador en el hospital. If you come into the office and she's coming to your place, she said, yo soy la codificadora del hospital. Here, who else is taking notes sometimes? Your doctors. The escribiente, the scribes. Yo soy escribiente, right? Doesn't change. Escribiente is going to be for male and female. Buenos días. Yo soy Amanda. Yo soy escribiente. Is introducing herself, is telling you what she does for a living. But if you want to introduce yourself, like to establish a relationship with somebody, you said, yo soy la escribiente. May I help you? Here, who is here? Yo soy técnico de oftalmología. Yo soy técnica de oftalmología. We saw some examples already. Is the person that helps the eye doctor, is the technician of the ophthalmologist. Here we have Mary Jo here, and she has a very interesting job. A patient access representative is the person that assists the patient with insurance, registration formalities. She does different things that nobody else understands. Believe me, no doctors, no nurses, no patients, no nothing, but she's the one that guides the patient in these difficult pathways of healthcare that we have right now. So how she's introducing herself? Hola, yo soy Mary Jo. Yo soy representante de acceso al paciente. Hey, Mary Jo, what do you do for living? Yo soy representante de acceso al paciente. But if Mary Jo wants to go to a room of the patient and tell what she's going to be doing, Hey, good morning. I'm Mary Jo. I am here to help you. Yo soy la representante. It's better. If you don't use la, it's okay. It's perfectly correct when you say yo soy la representante de acceso al paciente. If you skip it, if you don't remember when to use the article or no, you can skip it. That is still okay. We are still going to understand and we are going to fine tune those things. Okay. Next one here. Who else work with us? This person here, very important. Educador de diabetes o educadora de diabetes. Is a diabetes educator. Let's see this. Yo soy educador de diabetes en la oficina de la doctora Moreno en Gurney. So what's happening here? Yo soy educador de diabetes means I am the diabetes educator. Where? En la oficina. In the office. Of whom? De la doctora Moreno. Where? En Gurney. Let's change this a little bit. Let me grab my pen here and you can say, look at this. Yo soy educador de diabetes. Where? En la oficina de él, and the él I put it together and gets del, en la oficina del doctor Sfmp. Where? En Chicago, en New York, in Boston, or whatever it is. So you can be very specific here. Who is this teacher? Who's the owner of this teacher? Surgical coordinator, coordinador quirúrgico. So you probably already figured it out that quirúrgico means surgical. Coordinador quirúrgico, coordinadora quirúrgica. Yo soy coordinadora quirúrgica en el hospital de Evanston. This is a very interesting example because here both words change in gender. Coordinador changed to coordinadora for the female and quirúrgico changed to quirúrgica. You don't say coordinadora quirúrgico. You don't say coordinador quirúrgica. Has to match, right? In the first line, we have the male, and the second one, we have the female. What's here? She's a therapist working with a baby here. Yo soy terapista. Hey, Susan, what you do for living? Yo soy terapista. If she wants to be a little bit more specific, she can say, yo soy terapista ocupacional. Where? En el hospital de Skokie. If you are going to describe your job a little bit more in detail and you want to say where you work, you have to use this word en el hospital de Skokie, en el hospital de Brooklyn, en el hospital de Boston, en el hospital de Texas, en la clínica Mayo, whatever it is, you use the word and you link the two parts of the sentence. But she can be different type of therapist. She can say, yo soy terapista de lenguaje, yo soy terapista ocupacional, yo soy terapista sexual, different type of therapist, right? This is just examples of that. So let's see these little paragraphs here. Who is here in the upper slide? Buenos días. Yo soy el doctor Mauricio Sherman. Mucho gusto. Nice to meet you. Yo soy cirujano plástico del hospital de Evanston. I am the plastic surgeon de el hospital de Evanston. He can be using also en, and that is correct. So let me grab this. So he could have said, yo soy cirujano en el hospital de Evanston, and that is perfectly correct. In the moment that he's saying de él, which ended up in del, he's showing some like relationship with the hospital. Can be from or of. That is perfectly correct too. Let's see what's happening here down. Buenos días. Yo soy la doctora Patel. I'm Dr. Patel. Mucho gusto means nice to meet you. Soy residente de cardiología. I am cardiology resident, so it's a doctor in training, right? Cardiología is the department, and she's telling you that she's residente. Soy residente de cardiología, and she's telling you where she works. De el Hospital de Glenview. Yo soy médica residente de cardiología del Hospital de Glenview. So we have two different ways to say the same. Soy residente de cardiología del Hospital de Glenview. She could have said, yo soy médica residente, if she wants to be a little bit more specific about this. In Spanish, sometimes we skip the pronoun. Like in English will be something like, instead to say I am, I said just am. You don't use that. In English, you kind of must have to put the pronoun, right? In Spanish, we can skip sometimes the pronoun, and that is because the conjugations are so different for each person that just by listening the verb, soy, I know already that the person is trying to say yo soy, right? So be ready to listen sometimes soy without listening the yo soy. Next one here. Let's see how the patient may be introducing themselves. Let's read this. Hola, yo soy Mariana. Mucho gusto. Yo soy paciente de. Yo soy paciente de endocrinología. I am patient of endocrinology. That is the literal translation. I am endocrinology patient. Hola, yo soy Becky. Mucho gusto. Yo soy paciente de cardiología. So a lot of times the patients are going to find you in the hallway asking for help, and they are going to tell you, yo soy paciente de, and they are going to tell you, buenos días, yo soy paciente de endocrinología. What is endocrinology department? Buenos días, yo soy paciente de cardiología. What is the radiology department, right? Sometimes they introduce and they are asking you for directions. Let's see this. Who is this guy here? He's Andrew, and he's saying, hola, yo soy Andrew, nice to meet you. Try to fix this here. Use the previous slide here, yo soy paciente de, and try to fill here, yo soy paciente de. Pay attention which department maybe is he now. Next one here, look this patient that's showing the back to the doctor. Hola, yo soy. Try to finish this. Maybe you put Peter, maybe Matthew, maybe Charles, and put nice to meet you, and please tell where he is at this moment right now. Same here, hola, yo soy, blah, blah, blah. Nice to meet you. I am patient of oncology. Try to write this paragraph in Spanish. Pause the video right now and let me see your exercise. If you did the sentences in something like this, try to compare. Hola, yo soy Andrew. Mucho gusto. Yo soy paciente de traumatología. Remember, that is ortho. That is the traumatology department. If you did something like this, hola, yo soy Jason, or you put whatever name. Yo soy paciente de dermatología. Here, hola, yo soy Genoveva. Mucho gusto, nice to meet you. Yo soy paciente de oncología. Can you introduce yourself to a patient? Buenos días, yo soy la doctora Maritza. Mucho gusto. Yo soy médico familiar de Gorny. Or, buenos días, yo soy Angélica. Mucho gusto. Yo soy enfermera de cardiología. Buenos días, yo soy Matthew. Mucho gusto. Yo soy escribiente de Skokie. Remember that we use buenos días from like literally 6 a.m. in the morning until noon. Buenas tardes, like from noon to 6, 7, 8 until we don't have light. And buenas noches when it's completely dark. Okay? So thank you very much for joining in this session. Hope you like, hope you enjoy. Try to get my Facebook lives and try to subscribe to my channel in YouTube. And we will see each other at the end of this week for more lessons.